Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Asthma. Pediatric. Introduction. Asthma is the most common chronic children's disease. Learning that you have asthma might be scary for you and your parents. This program is for children and their parents. It will help you understand what causes children to have asthma. It will also explain how asthma makes you feel and how you can treat it. Anatomy. Oxygen is necessary for life. The lungs allow us to fill our blood with oxygen. The air we breathe comes in close contact with the blood that is in our lungs. The blood then fills up with oxygen and gets rid of CO2, which is carbon dioxide. When you breathe, air comes in through your mouth and nose. From there it goes through your air pipe, called the trachea. From the trachea, the air you breathe goes into a bunch of little tubes called bronchial tubes. At the end of the bronchial tubes are small balloon-like sacs called alveoli. The walls of the alveoli are very thin. Around the outside of the alveoli are small blood vessels. Oxygen that you breathe in goes through the very thin wall of the alveoli and into the bloodstream. Carbon dioxide, or CO2, goes the other way through the thin alveoli wall, from your blood to your lungs, to be breathed out. There are muscles all around the bigger bronchial tubes. All along the insides of your bronchial tubes you have a special substance called mucus. The mucus helps trap dirt from the air you breathe in. The mucus comes out when you cough. Very small brushes called cilia on the outside of the lung cells continuously push the mucus to the outside. If the mucus becomes significantly big, it is coughed out. Symptoms and their causes. Asthma makes it hard for you to breathe. This causes a feeling of tightness in your chest. People with asthma are sensitive to things that cause the inner lining of their lungs to swell up. The swelling can make the tubes that air flows through when you breathe get very narrow. When the lining of your lungs swells and your air pipes get narrow, it makes it hard to breathe. It can also make your chest feel tight. You can also hear your lungs wheeze when you breathe in and out. The muscles around the bronchial tubes could also tighten, making your air pipes even narrower. When an asthma attack occurs, the lining of the lungs quickly becomes swollen. The air passages get lined with thick mucus, and the muscles around the bronchial tubes tighten. This causes much less air to flow into the lungs, making it very difficult to breathe. During an asthma attack, you may have chest tightness, chest pain, headaches, shortness of breath, coughing, wheezing, or tiredness. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Triggers. Many things can cause the lining of the lungs to swell up. All of these things are called triggers. Triggers can be things that you're allergic to. Animal hair, mold, pollen, and dust are examples of allergens. These allergens can trigger an asthma attack. Extreme conditions, such as very cold or very hot weather, can also trigger an asthma attack. Particles in the air, for example car exhaust, perfume, or secondhand smoke, could be a trigger. Certain medications, such as aspirin or ibuprofen, may act as a trigger. Sometimes chemicals that are added to food can be a trigger. For example, a lot of food that you buy in cans have chemicals called preservatives in it to make it last longer. Some diseases or infections, such as a cold or pneumonia, can trigger an asthma attack. If you laugh or cry really hard for a long time, it could trigger an asthma attack. Strong feelings, such as being angry, sad, or excited, can be a trigger. Diagnosis. If you've had trouble breathing or wheezing a lot of different times, that might be a sign that you have asthma. After taking a detailed medical history and listening to your lungs, your doctor may ask you to have a special test done called a pulmonary function test. This test helps the doctor find out how well your lungs work. Pulmonary function test can only be done on children older than 5 years of age. Peak flow measurement is a part of this test. You may be taught how to do this at home after your visit to the doctor. This test helps you know when an asthma flare-up is starting and how bad it is. You will need to blow into a tube as hard and fast as you can. A marker on the side of the tube shows how fast your breath is blown out of your lungs. A chest X-ray may also be done to check for other diseases that have the same symptoms as asthma, such as pneumonia. A skin test may also be done to help you recognize possible triggers. Treatment options. The most important part of the treatment plan for asthma is to prevent severe asthma attacks by using long-term medicines. These are usually taken every day. If an asthma attack has already started, the treatment will be to stop the attack and make your breathing as close to normal as quickly as possible. It is important for you and your parents to monitor your breathing on a regular basis using the peak flow measurement. This helps you and your parents to notice and treat breathing problems before an acute attack occurs. It is also important to control the triggering factors. Washing pets once a week, getting rid of household items where there may be a lot of dust, thick carpets, blinds, etc., and the use of air conditioning are all ways to avoid triggers. Proper use of medication is also important in the treatment of chronic asthma and prevention of asthma attacks. You may be taught how to use an inhaler before you leave the hospital. You may be given a mask to breathe in the medicine at home. Treating chronic asthma usually involves taking medications that will decrease the swelling of the bronchial tubes and make your lungs less sensitive to allergens. These medications can be given as pills, shots, or inhalers. Some medications are sprayed into the nose. To prevent or stop acute attacks of asthma, bronchodilators such as albuterol are used. These medications relax the muscles of the bronchial tubes. Some of these medications act quickly and are inhaled. Others act over longer periods of time and are usually taken by mouth. Even though some asthma attacks are brought on by exercise, as long as you ask your doctor about it first, exercise helps the overall health of the lungs, heart, and body. Asthma does not stay the same all the time. Your doctor will work with you to figure out an asthma action plan. Your action plan will tell you which medication to use when you are in good control, having a mild flare-up, or having a severe flare-up. It's a good idea to share the action plan with teachers, caregivers, and other adults. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Asthma is a lung disease that affects your ability to breathe. Learning that you have asthma might be scary for you and your parents. When an asthma attack occurs, the lining of the lungs quickly becomes swollen. The air passages get lined with thick mucus, and the muscles around the bronchial tubes tighten. Many things can cause the lining of the lungs to swell up. All of these things are called triggers. To prevent or stop acute attacks of asthma, bronchodilators such as albuterol are used. Regular treatment is needed even when you do not have symptoms. The most important part of the treatment plan for asthma is to prevent severe asthma attacks by using long-term medicines. These are usually taken every day. Knowing about the disease and its treatment options has helped children with asthma live a better and healthier life. Thank you for using Explain.